today's special press conference on COVID-19 updates, but also on the outcome of the second special session of the World Health Assembly. It's my pleasure to welcome you today on Wednesday, 1 December 2021, out of this very room where the special session was held. It's the first time that we do a press conference out of this room, so we're all very excited and a pleasure to have you all with us on this very, very special day. My name is Christian Lindmeier, and I'll guide you through this briefing today. We have simultaneous interpretation available in the 6 official UN languages: Arabic, Chinese, French, English, Spanish, and Russian. And now let me introduce the participants, and if you see the full room, I'll start from left to right. We'll have on the very far left from my end, at least, Dr. Bruce Aylward, Senior Advisor to the Director General and the lead on ACT Accelerator. We have then Dr. Mariangela Simao, the Assistant Director General for Access to Medicines and Health Products. And there's Dr. Joad Majour, the Assistant Director General on Emergency Preparedness and the International Health Regulations. Next is Dr. Mike Ryan, Executive Director of WHO's Health Emergencies Program. Then, of course, Dr. Tedros Adhanom Ghebreyesus, WHO Director General. Next, Dr. Maria van Kerkhove, Technical Lead on COVID-19. Chief Scientist, Dr. Soumya Swaminathan, and last but not least, Mr. Stephen Solomon, our Principal Legal Advisor at WHO. Welcome again, and I'll hand over to Dr. Tedros.
Thank you, Christian. Good morning, good afternoon, and good evening. As you know, today is a momentous day for global health. Today, WHO's member states decided to embark on the process of drafting and negotiating a new convention, agreement, or other international instrument on pandemic prevention, preparedness, and response. The significance of this decision cannot be overstated. Just as countries have united in the past to adopt treaties against tobacco, nuclear, chemical, and biological weapons, climate change, and more, and so today, the nations of the world have made a strong statement that health security is too important to be left to chance or goodwill, or shifting geopolitical currents or vested interests. A convention, agreement, or other international instrument will not solve every problem, but it will provide the overarching framework to foster greater international cooperation and provide a platform for strengthening global health security. In their decision today, member states agreed to establish an intergovernmental negotiating body to begin drafting and negotiating a new accord. They committed to holding their first meeting by the 1st of March next year and to submit the outcome of their negotiations to the World Health Assembly in 2024. That may seem like a long process, and it is, but we should not be naive in thinking that reaching a global accord on pandemics will be easy. The idea of an international instrument on tobacco control was formally initiated in 1995. But the Framework Convention on Tobacco Control did not enter into force until a decade later. Of course, we hope that this process will not take nearly that long. But there are still differences of opinion about what a new accord could or should not contain. Nevertheless, today countries have proven to each other and the world that differences can be overcome and common ground can be found. The spirit of solidarity that we have seen today is what we need, not just to prevent and mitigate the impact of future pandemics, but to end this one. The emergence of the Omicron variant has understandably captured global attention. At least 23 countries from 5 of 6 WHO regions have now reported cases of Omicron, and we expect that number to grow. WHO takes this development extremely seriously, and so should every country. But it should not surprise us. This is what viruses do. And it's what this virus will continue to do as long as we allow it to continue spreading. We're learning more all the time about Omicron, but there is still more to learn about its effect on transmission, severity of disease, and the effectiveness of tests, therapeutics, and vaccines. Several WHO advisory groups have met over the last couple of days to evaluate the emerging evidence and prioritize the studies needed to answer these questions. I thank Botswana and South Africa for detecting, sequencing, and reporting this variant so rapidly. It's deeply concerning to me that those countries are now being penalized by others for doing the right thing. We call on all countries to take rational, proportional risk reduction measures in keeping with international health regulations. This includes measures to delay or reduce the spread of the new variant, such as screening of passengers prior to traveling and or upon arrival, or the application of quarantine to international travelers. Blanket travel bans will not prevent the international spread of Omicron, and they place a heavy burden on lives and livelihoods. WHO continues to call on all countries to optimize public health and social measures and ensure that high-risk and vulnerable individuals in all countries are fully vaccinated immediately. At the same time, we must not forget that we are already dealing with a highly transmissible, dangerous variant, the Delta variant, which currently accounts for almost all cases globally. We need to use the tools we already have to prevent transmission and save lives from Delta. And if we do that, we will also prevent transmission and save lives from Omicron. But if countries and individuals don't do what they need to do to stop transmission of Delta, they won't stop Omicron either. Globally, we have a toxic mix of low vaccine coverage and very low testing, a recipe for breeding and amplifying variants. That's why we continue to urge countries to fully fund the ACT Accelerator to ensure equitable access to vaccines, tests, therapeutics all over the world. As we mark World AIDS Day, we're reminded that more than 40 years into the global AIDS epidemic, we still have no vaccine and no cure for this disease. 2 years into the COVID-19 pandemic, we have not one, but many vaccines and many other effective tools. This virus has demonstrated that it will not simply disappear. How many more lives and livelihoods it takes is up to us. Ending the pandemic is not a matter of chance. It is a matter of choice. Christian, back to you.
Thank you very much, Director General. Let me now open the floor for questions, and to remind everyone, please unmute yourself when you're called upon. And we will start with Sophie Mokena from South African Broadcasting Corporation. Sophie, please unmute yourself.
Thank you so much. I just want to find out, you spoke about the issue of the variant, the new variant that was detected by South Africa. The decision by developed countries such as UK, United States of America, and the EU to impose travel restrictions against SADC member countries has led to a loss of economic spin-off, or it has got a negative impact on the economy of these countries that are still struggling to rebuild their economies after, due to COVID-19. What is your message to the globe in terms of what must they do when there are information such as this? Because this will lead to the deterrent where you'll find countries not sharing information.
Thank you very much, Sophie. I'll hand over to Dr. Shuad Majur, Assistant Director General, Emergency Preparedness and IHR.
Thank you very much for this very important question. In fact, there is some modelings that shows that travel ban may be helpful in the beginning of an outbreak to give more time to countries to be prepared to the spread. But it is clear that a travel ban cannot stop the circulation of virus, and more importantly, the traveler can jeopardize the effort to fight against the outbreak. This is why we call that all countries should apply comprehensive measures from the countries of departure and the countries of arrival, and using risk-based approach and evidence-based approach on the situation to take a comprehensive measure, including testing, including checking of symptoms and others. And these measures could be more effective to prevent the spread of the new variant.
Thank you very much. And Dr. Van Kerkhoff.
I just want to take this opportunity to thank the scientists from South Africa and Botswana and all over the world who are working with us to share this information in almost real time. The detection of this variant in South Africa was reported to us through our technical advisory group for virus evolution very quickly. And immediately, we held meetings where information analysis was shared with us and with our partners, the advisory group for virus evolution, so that decisions could be made. And I think that should be commended. What should also be commended is the improvements and enhancements of testing and sequencing that have happened throughout the course of this pandemic, particularly in South Africa, but also in Southern Africa. There are a lot of efforts that are underway, and of course, this needs to continue to be improved. We need investment in this, but we need countries to continue to do surveillance for SARS-CoV-2, whichever virus is circulating. And remember, Delta is dominant, but the more the virus circulates, the more opportunities it has to change. So we need to strengthen our surveillance around the world. We need to strengthen our genomic sequencing around the world, make sure that we have better geographic representation all over the planet, and that information continues to be shared with us. We do not want to see countries penalized for sharing information, because this is how WHO and our partners, this is how we make assessments and how we provide advice. So I do want to say a special thank you to so many researchers across South Africa. I wish I had the list of institutions in front of me, but there are many, for the great work that they do and will continue to do, and to thank them for reporting this to us in such an open manner, and as well as to scientists in other countries that continue to do the same.
Thank you. Next question goes to Robin Millard from Agence France Presse. Robin, please unmute yourself. Robin Millard, AFP.
Thank you. Can you hear me?
Please go ahead.
Thank you. On Omicron, the most optimistic scenario is that Omicron ultimately turns out to be both more transmissible and less dangerous than Delta. If that turned out to be the case, what would that actually mean in practical terms for the world in the months ahead? Thank you.
Dr. Van Kerkhove? Or?
Yes, thank you. Thank you for the question. So there are a lot of different scenarios that we're considering for Omicron, and of course it's still very early days in terms, is it okay? Okay, so it's still very early days in terms of our understanding of this variant, and again, we're grateful for the information that's coming in daily. There is the possibility, we don't have all the information yet on transmission in terms of if there is a fitness advantage, if it's more transmissible. There is some suggestion of that, but again, it's early days. We expect to have more information on transmission within days, not necessarily weeks, but in days. In terms of the severity profile, we have seen reports of cases with Omicron that go from mild disease all the way to severe disease. There is some indication that some of the patients are presenting with mild disease, but again, it's early days, and we do have a surveillance bias right now in terms of the cases that are being detected. There is also a suggestion of increased hospitalizations across South Africa, but that could be a factor of the sheer fact that we have more cases. And if you have more cases, you'll have more hospitalizations. So with regards to severity, there are studies that are underway looking at hospitalizations, looking at those individuals who are hospitalized, whether or not they have this variant or not. And we're also getting a picture of some of the cases that are detected in other countries. So as the Director General mentioned, there are reports of Omicron in 23 countries. We expect that number to change. And it's important that information on these cases are also shared with us so that we learn more. But it is certainly possible that one of the scenarios is that the virus, as it continues to evolve, may still have a fitness advantage, meaning that it could become more transmissible than Delta. We'll have to see. But we don't know quite yet about the severity. I do think we should caution about sort of a best case, worst case scenario. The more this virus circulates, the more infections there will be. The more infections there will be, the more people will die. And this is something that can be prevented. So everything that we can do for Delta, which is dominant worldwide, needs to be applied and strengthened for Omicron. So however this unfolds, the way that we act now, the decisions that are taken now in every country will benefit however Omicron unfolds.
And Dr. Swaminathan, please.
Just to add to what Maria said, I think it's also very important for countries to really strengthen, expand vaccination coverage, especially in the priority populations. We know that it's people above 45 with underlying comorbidities who are at highest risk of developing severe disease after getting infection, whether it's Omicron or Delta or any of the variants. And we know that vaccines are likely to have some protection. We still need to find out if there's any loss of protection. But we think vaccines will still protect against severe disease as they have against the other variants. So this is a call for countries to really look at their own data, look at the groups that have been vaccinated, where are the gaps, what can be done really to get people who've been unwilling or who may have difficulties in accessing the vaccination sites. So we really need to look very practically at the delivery constraints. And also a call to all countries who are donating vaccines. We're very thankful, but we would like to see some advance visibility and transparency in when the doses will be available, which doses will be available. Companies need to tell us very clearly how the supplies are going to flow through COVAX. This is the time that we need increased vaccines to flow through COVAX to the countries, and we are going to prioritize countries with low coverage. And so I think it's a wake-up sign for us, as the DG has said many times, to really think about, as a world, what do we do with available vaccine supplies now, and how can we get them into the arms of people who haven't been vaccinated yet? Thank you.
Thank you very much, both. We have a long line of interested journalists, and we continue with Andrew Joseph from Stat News. Andrew, please unmute yourself.
Hi, thanks for taking my question. I appreciate it. So when some of these neutralization studies start coming out on Omicron, can you explain how, I guess, people should interpret them and how they could be used to make any potential policy decisions on vaccine design or boosters or whatever else? Like, so what's the significance of a 5-fold drop versus a 50-fold drop? And at what point is that worrisome? And how much can these studies actually tell us about protection against more severe outcomes? Thank you.
Dr. Swaminathan, please.
Yeah, that's a great question. I can start, others might want to add. So the ways in which we assess immunity to this infection, or when, either to natural infection or when vaccination is given, is through looking most commonly at neutralizing antibodies. So antibodies, of course, bind to the virus and prevent them from infecting the human cells by binding to the spike protein. And so if you already have these antibodies in your system, then when you're exposed to the virus, it can actually prevent the virus from getting in, or even if it gets in, prevent it from multiplying and causing disease. Now, there are other arms of the immune system. As you know, there's cell-mediated immunity through the T cells. And these also play a very major role in protecting against severe disease particularly, but they're less easy to measure. And so most studies are done using neutralizing antibodies. But it's important to remember that. So the drops in antibody titers actually tell us, whether what's the approximate level of antibodies you need in the blood to really feel that you're protected. And unfortunately, we do not have a consensus on what we call a correlate of protection. We cannot go out and say this is the number above which you are protected or this is the number below which you are vulnerable. It's a range, and there's a range above which we think most people are going to be protected. These kind of studies are helpful, particularly when we're looking at different vaccines that have been used to see whether, if any one vaccine or group of vaccines is more effective, but also it tells us whether we need to make changes in the vaccine. And this is the kind of data that the TAG COVAC, which has been set up by WHO, will be looking at. They're already meeting and deliberating on the criteria that may be used to recommend a change in vaccine composition. And so we also have a meeting. The R&D Blueprint is organizing a meeting on December 6th to discuss the data that's now currently available around the world on neutralizing antibodies, not just against this variant, but the whole body of work. There's quite a lot of data now to see whether we can start coming towards some agreement on some correlates of protection. So at the moment, it's important that labs around the world that are doing this do it in a standardized way. And again, this is why the R&D Blueprint expert groups on animal models and assays has been meeting to decide who's going to do which studies, what assays are going to be, how they're going to be standardized, which are the priority assays, and also to help the virus samples and the reagents to move around the world. And this is one of the reasons why travel bans can pose challenges and difficulties to researchers and countries, because we do need at this time a free movement of reagents, of lab consumables, samples. That's going to advance our understanding as fast as possible. Thanks.
I would just like to emphasize one point, because I think, Andrew, it's a great question, but I think viewers who are out there who are listening to this may be really worried. And we just want to assure you that the vaccines that are in use right now have very strong protection against the dominant virus that is circulating globally. So it is absolutely critical that when it's your turn, you get vaccinated, because the chances of you developing severe disease and dying with vaccinated is significantly less than if you're not vaccinated. Vaccines are saving lives, and we need vaccines to get into the arms of all of those who are at risk in every single country, not just in some countries, and not adding more vaccines to people who are already protected, but getting the first and second dose to those individuals who are at risk in all countries. And this is really important that this is crystal clear today, because there is still a lot of uncertainty around Omicron, and this data will come in, and there are scientists around the world that are studying this, but there's no indication to suggest that the vaccines won't work. Even if there is a reduction in efficacy, it's still better to have the vaccine because it will save your life. So please make sure that that's clear in all of the reporting, because we don't want to scare people unnecessarily. We want people to understand out there that there's a system in place to detect these variants, to study these variants, and to advise us, WHO, to make informed decisions so that actions can be taken to save as many people's lives.
Thank you very much. Next question goes to Simon Ateba from Today's News Africa. Simon, please unmute yourself.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington. And thank you for doing this very important and widely watched press briefing on the Omicron variant. On the timeline of this new variant, authorities in Botswana have said that the Omicron variant was first detected in foreign diplomats who entered the country on November 7 and tested positive on November 11. South Africa informed the WHO about the new variant on November 24. And there are confirmed reports that the variant was already in the Netherlands a week before South Africa detected it and did the right thing by quickly informing the world. If this timeline is not correct, can you please tell us exactly when and where the new variant was first detected and how it has been spreading? And if this timeline is correct, doesn't this mean that the variant has already spread to many parts of the world, more than we currently know? And travel bans on Black and Southern African nations are, to say the least, useless and quite honestly, pardon my French, a stupid thing to do. Thank you.
Thank you very much, Simon. I think we've been over this a couple of times, but let's reiterate.
So I could start, and others may want to come in here. So Simon, great question. I think the timeline for when this virus, the Omicron virus, was detected, I think the timeline will change. And the reason for that is now that this variant has been classified as a variant of concern, there's a lot of attention to this. So surveillance will increase, testing will increase, sequencing will increase. There's also a backlog of sequencing from cases that have occurred in the month of November, for example. So the timeline may change. The countries that will have detected this variant may change. And so I wouldn't put too much emphasis on exactly when and where yet. However, having said that, it was South Africa and Botswana that did report this to us and inform us. But as those sequences get sequenced, as that backlog they catch up with that backlog, the timeline itself may change. We don't yet have the full picture, but as I said, there are many that are working on this. For how long this has been circulating, I think that will take a little time to determine. But I do want to emphasize that the fact that this was reported to us on the 24th, the TAG VE, the Technical Advisory Group for Virus Evolution, met on the 26th and advised WHO to classify this as a variant of concern, which we did. Things are happening quite rapidly, and rightly so. And we need that to continue. So we encourage countries to enhance their surveillance, to enhance their sequencing, and to keep reporting that information, to share those sequences on platforms like GISAID, and a special thanks to GISAID as well, so that analysis can be done and we can better understand its emergence.
Thank you very much. Next question goes to Stephanie Wegenast from Global. Stephanie, please unmute yourself.
Hi, thank you very much for taking my question. This is regarding Brazil. Obviously, Omicron has been identified in Brazil already as well, which, given its size, is always an important country to watch. And one of the big debates there at the moment, it's whether it will be possible to have New Year's Eve and Carnival celebrations in bigger scales. Obviously, New Year's Eve now, Carnival in February. Does the World Health Organization have any guidance from Brazil, specifically in relation to these major events that are so important to the culture and obviously to the economy as well?
Thank you very much. Thank you very much, Stephanie. Who do we start with? We'll start with Dr. Van Kerkhove.
Yep. So thanks very much for the question. I think we have guidance that's put out that advises on how gatherings should or should not take place and how they can happen as safely as possible. I'll just remind you that the factors that are driving transmission right now and have been driving transmission are not just these variants that are being detected, but also increasing social mixing. in the context of the inappropriate use of public health and social measures, not lockdown, but things like masking, hand hygiene, distancing, improving ventilation, et cetera. And in that context, if you have any of those types of factors and a virus is circulating, it will take advantage of that. But there are many situations in which gatherings can take place in a safer way if the right provisions are in place, if there's surveillance in place, if there's detection in place, if there's distancing in place. And in some situations, maybe those gatherings shouldn't take place, but that's a case-by-case basis. And so we have issued guidance on mass gatherings to take a risk assessment about what can be done if the gathering takes place, where that gathering takes place, indoors versus outdoors, how many people will be there, and all of the other provisions in place. Is vaccination required? Is testing required, et cetera? So we don't give a blanket yes or no, but we do ask everyone, even if it's in your individual life or if it's whether it's a gathering, to take steps to lower your exposure to this virus, because there's a lot that you can do to prevent yourself from getting infected and passing that virus to somebody else.
Thank you very much. Next question goes to Jeremy Lange from RFI. Jeremy, please unmute yourself.
Thank you, Christian. I would like to know, since it will take weeks, as you said, to know exactly what Omicron means for the pandemic, and that we are about to enter in Europe into the holiday season, and Europe is at the epicenter of the pandemic. I was wondering if you think that European countries should adopt a principle of precaution and take particularly strict measures. I mean, the underlying is, are we heading towards a lockdown Christmas, basically?
Thank you for the question. Yeah, it may have been good if European countries took a lot more precaution over the last 4 months and did the things we need to do to protect populations in terms of vaccination and public health and social measures from the deadly variant that's currently circulating. That variant is called Delta virus, the Delta variant. The DG has said, and Maria spoke again, the things we will do to contain and control the Delta variant will likely stand us in good stead should the Omicron variant continue to spread or demonstrate any signs of increased severity or vaccine escape. So I would encourage governments in Europe to look at their epidemiologic situation, to examine the mixture and the layering of their control measures, the focus they have in finding those individuals, particularly highly vulnerable ones, as Sumia said, who are highly vulnerable or at risk, and making sure that they're offered vaccine and that their concerns regarding the vaccines, if they have hesitancy, are addressed openly, and that we try to convince and persuade people to be vaccinated, as well as beefing up and intensifying surveillance, increasing and expanding testing, ensuring that clinical pathways are well managed and the right patients get the right treatment at the right time, ensuring that we engage and empower communities and ensure that they're supported and not left alone. This is not a time for governments to pass the full responsibility of containing this epidemic and pandemic back onto the shoulders of individual citizens. This is a time for governments to take action in solidarity with their communities, not in blaming their communities. And it is time for everyone to recommit ourselves to controlling the pandemic of multiple strains. Or multiple variants of the same virus. We will have to be a little patient in order to understand the implications of the Omicron variant. But certainly we are dealing with a crisis now, and that crisis is in Europe, and it's been driven by the Delta variant. Thank you.
Thank you very much, Dr. Ryan. Next question goes to Tomo Deguchi from Kyodo News. Tomo, do you hear us? It seems not. Then we're moving on to Carmen Paun from Politico. Oh, do we have Tomo back?
Can you hear me?
Yes, please. Go ahead.
Sorry. Thanks for taking my question. Even after you sent out the advice last night saying that the blanket travel ban is not effective in preventing the international spread of the new variant. More and more countries are implementing such measures. Like Japan, they are now banning all known Japanese to enter the country. Could you please send a stronger and clearer message to the countries which are acting not based on scientific evidence? Thank you.
Tomo, we're not very sure if we understood everything right. It was quite interrupted, but if I get it right, it was about the possible travel restrictions put up by Japan right now in plan. Is that what you're asking?
Yes, basically. Could you please send a clear message that blanket travel ban is not effective on preventing
Then
spread?
we have it. Then I'm asking Dr. Jouad Majour, Assistant Director General. Mike Ryan, maybe?
No, thank you very much. And as we say that a blanket travel ban will never stop the circulation of the virus, but instead what is needed is comprehensive approach based on real risk analysis and also based on evidence to doing things that does work and avoiding that definitely will not work. And of course, member states and countries, they have the right under the international health regulations to take additional measures to protect their countries. But these measures should be always based on clear public health justification, based on science, and also based on clear risk analysis and implementing the measures that can protect, but avoiding the measures can stop travel without protecting. Mike?
I agree with Jawad. And when we talk about a risk-based approach or enhanced methods, there are ways that you can de-risk travel in terms of having increased testing, more testing before departure, more testing on arrival, quarantine until negative testing. There's a whole series of things that can be done that will manage the risk of importation of disease or even exporting disease to another country, which falls short of blanket bans. There's also some inherent internal contradictions in these bans. We've seen these before, where you ban flights except for your own citizens. I mean, epidemiologically, I find it hard to understand the principle there. Is it that some passport holders will have the virus and some won't? Does the virus read your passport? Does the virus know your nationality or where you're legally resident? So therefore, there are contradictions in this. So our concern here is that we apply public health principles, not political principles, to selecting measures that are used to control the spread of disease, and that those measures are are targeted at reducing transmission of the virus while presenting the least possible imposition on individuals' rights and freedoms of movement, which is a cherished freedom all over the world. There are economic and social consequences to travel bans, particularly blanket travel bans, but there are circumstances in which in modifying travel, in reducing travel, and in adding more checks within the process of travel can help to reduce or at least delay the spread of some disease. But that in no way should be even used as a single measure. The Director General has said it, intensifying current surveillance and testing in countries. You are going to miss cases. They're going to come in your land borders. They're going to come in through third and fourth airports. So the idea that you can put a hermetic seal on most countries is just frankly not possible. We all know that. We've seen that happen before. And certainly there has to be consistency in that. If they are being applied, they have to be consistent. And certainly we've seen a lot of inconsistency with countries, for example, in Africa, having banned travel and they haven't had a single confirmed case, and other countries with confirmed cases and evidence of local transmission with no travel bans. So I'm not saying one is right or one is wrong. What I'm saying is I can't see the logic, certainly from a public health or an epidemiologic perspective.
Thanks you so much. Next question is indicated now to Carmen Pound from Politico. Carmen, please unmute yourself.
Thank you for giving me the floor, Christian. I wanted to ask about the agreement to start negotiation towards an accord or potentially a treaty. I was wondering if you believe that the agreement, whatever shape or form it's going to take after negotiations, will help in any way ease or navigate some of the geopolitical tension and nationalists that have marred the response to the pandemic so far. And if you can say a bit like how you see that happening. Thank you.
Thank you very much, Carmen. And let me call upon Stephen Solomon, our Principal Legal Officer.
Thanks very much for this question. I think it's fair to say that member states made a very clear decision today to seize the moment to begin negotiations actively with very clear timelines towards new international rules on preparing for, preventing, and responding to pandemics. I think in specific answer to your question, there is a very clear consensus that equity and equitable considerations should be at the heart of those discussions. And because of the imperative, both morally and in terms of smart public health, of addressing equitable principles, I think there is reason for hope that there will be a work to promote cooperation among countries, which will have very important geopolitical effects, hopefully, in ensuring solidarity.
Thank you, Mr. Solomon. Dr. Jawad, please.
Yeah, thank you. Just to complement what Steve said, that what we have been hearing from member states these 3 days, and also when we went through the analysis of the more than 300 recommendations coming from different panels, it became very clear that any international framework that member states will discuss in the future, it should be based on 4 pillars, 4 major pillars that complement each other and allow the world to be better prepared, and if when a pandemic happens, to better response. These 4 pillars are: 1, governance and leadership at the national level, but also at the global level, to bring countries to work together and also to bring the whole country to work together. Second pillar is about financing of preparedness at the country level from domestic resources, but also from international solidarity to finance countries who cannot mobilize financing for their preparedness, but also to finance global mechanism that would be in place to prepare. The third pillar is global systems and tools that allow the WHO and countries to establish mechanisms that can be done during the preparedness phase to be activated during the crisis, the health crisis. And it's always very difficult to establish new tools when you are responding. It will be much, much helpful if these systems are established and funded before the crisis. And the last one, as Steve said, is equity. Equitable access and timely access to goods and control measures is extremely important to give all countries the same chance, the same tool to prevent, but also to respond to health crises when they occur. There is clear consensus that these are the 4 areas that need to look at, and this area will definitely complement each other.
I think today, and thank you, Jawad and Steve, personally for your leadership and the leadership of all of the teams who worked on this under Dr. Tedros' guidance to work with our member states to get to where we are today. The beginning of a very important journey, and maybe control for the first time in history over the threat and risk of pandemics in future. We began that journey, I think, over the last few days, officially. But just to say, I think that, frontline responders in public health and healthcare, they're sick of counting the dead. They're sick of losing their friends. They're sick of watching their communities devastated. And that's not just for this COVID, but for so many other epidemic diseases, be it cholera, Ebola, and others. We have the means. We have the science. We have the knowledge. We have the the methods and the ability to bring so much to bear to prepare for and respond to these events. The leadership of our member states today in agreeing to move forward has been fantastic. The Director General spoke to that very passionately earlier in his speech to the Assembly. Abraham Lincoln once said, "The best way to predict the future is to create it." And today we may have begun to create a new future for our children. Thank you.
Thank you so much. Now we move around the globe again and come to Latika Burke from the Sydney Morning Herald. Latika, please unmute yourself.
Thank you very much. Dr. Tedros, you said in your opening statement that there were a lot of sticking points that could potentially hold up how soon you could negotiate this treaty or convention. Could you talk through some of the sticking points that you anticipate and what an ideal outcome would be?
Do we want to start with Dr. Solomon? Mr. Solomon?
Thank you. So one of the things that member states have done in this decision, which they adopted today by consensus, meaning every country, all 194 member states agreed to this decision, is set out clear timelines and milestones to reach. First, a working draft, and that will happen very quickly, actually. By August, there should be a working draft. And then to further develop that working draft. The point here is that the efforts to develop any instrument, any rules, is complicated, particularly where you have the challenges in the various areas that Dr. Major has outlined. What is important here is that there be a transparent and inclusive and consensus-based process among member states to work it out, and that member states have made clear that it should involve all relevant stakeholders. So what will help in roadblocks, and there will be roadblocks and there will be difficulties ahead, is a clear process with good leadership and transparency and involvement of whole of society with an approach by member states that works with the goals that were outlined by Dr. Major in mind.
And Dr. Jawad, please.
Yeah, thank you. I think during the last 3 days, we didn't hear any country who said that we don't want an international instrument to bring us to work together in solidarity. I think the small differences in the approach. Many countries would like to define the legal framework of the instrument before start negotiation, and others they prefer to negotiate the content before defining the legal instrument. I think this is the small things, but of course there is some still existing some small differences. But as Steve said, that the fact that the member states adopted the decision in consensus, it demonstrates their willingness to overcome their differences and work together, and hopefully they can come up with something strong enough to better prepare the world and ensure better response to future health emergencies.
Thank you very much, both. And next question goes to Tom Clark from Sky News. Tom, please go ahead.
Hello, can you hear me?
Yes, go ahead.
Thanks for taking my question. Yes, firstly, what would be your opinion of the UK government's decision to offer third doses of vaccine, millions of them to people who are under the age of 40, not vulnerable to, particularly vulnerable to severe COVID, given you spoke earlier of solidarity and vaccine equity? And secondly, perhaps for Dr. Kakova, is there a disincentive, are you concerned now, for scientists in other countries to step forward, to be open about the new variants they might be seeing in their surveillance data, given the reaction to South Africa and Botswana and other African states?
Let me look around the room where we should start. Dr. Ryan, please.
I think this question was related to the UK and vaccines and boosters, but Yeah, it's maybe it's tough for some countries who have huge amounts of excess vaccine to decide who would give it to, but that's not the problem been faced by a lot of countries around the world who can't get even primary vaccination to their most vulnerable. So it's a luxurious position to be in if you're in a position to be able to have enough vaccine to do that. The situation right now, and I think Dr. Samuel said it earlier, the primary objective, I think, of all governments now must be, in the face of Delta and Omicron and others, is to ensure that all vulnerable individuals, people of older age, people with underlying conditions, are immediately offered the vaccine, and to ensure that everyone has had at least a primary course of vaccine. There are others here who can better answer than me regarding the benefits of a booster regarding other variants, but right now there is no evidence that I'm aware of that would suggest that boosting the entire population is going to necessarily provide any greater protection for otherwise healthy individuals against hospitalization or death. The real risk of severe disease, hospitalization and death lies in particularly at risk and vulnerable individuals who do require protection against all variants of COVID-19. Some of you may have a point on this.
Thanks, Mike. Just want to reiterate what was just said, that our goal should be really to protect those who have not yet received their primary course of vaccination. And this is true in all countries. There are all countries that still have vulnerable populations that have not been vaccinated for one reason or another. Of course, there are a large number of low-income countries where it hasn't happened because they haven't had the supplies. But there are also high-income countries that have still not achieved coverage above 60 or 65%. And so there's still a lot of work to be done on the primary vaccination of adult populations, particularly the vulnerable groups. And some countries are doing, as a precautionary principle, providing additional doses to people because they have adequate supplies, and they're just doing it. There isn't a whole lot of evidence that everybody over the age of 18, or for that matter above any age, is going to benefit from this. So what we really need is the data to come in from many countries using different vaccines, different demographics, different populations and coverage, and also different variants at different times during the year to have a comprehensive view on when boosters are going to be needed, which subgroups of people they're going to be most useful in, and which vaccines should indeed be used. And so there's a lot of research going on. SAGE is looking at the data. They will be meeting in the first week of December to look at all the evidence, to review it, and then to make recommendations to the DG and then to member states on how each country should look within their own context, at their own population, to decide on additional doses. But at this point, again, the plea is to vaccinate the unvaccinated first. Thanks.
Can I comment on the second part of that question on the disincentive? So the second question that you asked was around, will there be disincentives for people to report, given the reaction that we've seen to this? And that's certainly a worry. We, as WHO, we rely on our member states. We rely on public health professionals, those who are carrying out surveillance, those who are caring for patients in countries, researchers across academia, the public, the private sector, to share information with us as quickly as possible so that decisions can be made. Any changes in our advice or guidance or recommendations need to be done, and that needs to continue. And so certainly, if there is any disincentive, if countries feel like they will be penalized for reporting that information, that is, of course, a worry for us. We, rely on this information, quite frankly, and we need to somehow figure out that all of us are either in this together or we're not. You cannot have a pandemic in part of the world and not in others. And for the record, we're very much in the middle of this pandemic. The fact that we have new variants emerging will continue because the virus is circulating. So not only do we need to increase vaccination coverage around the world, and not just percentage-wise, but making sure that we reach those people who are most vulnerable first in all countries, not just in some. we also have to take measures to drive transmission down. And again, that does not mean lockdown. What that means is using proven public health and social measures, which, quite frankly, many people around the world are getting used to. It does not mean we will need to do this forever. We will get out of this pandemic, but everyday decisions need to be made of whether or not we're getting closer to the end of this pandemic or we're actually taking steps to prolong it. So I think we know what we need to do. We know it's very difficult, but as we enter the third year of this pandemic, we have a long way to go and we need to put in the work. So we need countries to continue to report. We should be thanking them. And I don't think us sitting up here could thank them. We could probably thank them every single day, and in fact, we do. So we encourage that to continue.
Thank you very much, all. We're coming slowly close to the hour, but we may just be able to squeeze in one last question from AP, Jamie Keaton. Jamie, please unmute yourself.
Hi, thank you, Christian, for taking my question. I'd like to build on what Dr. Swaminathan said earlier. Have the travel bans and suspensions of flights already begun to impede international cooperation in assessing Omicron, such as through the sharing of samples or reagents? Or is that still theoretical at this point? And building on Robin's question earlier, just very quickly, what figures, if any, do you have about the deaths so far linked to Omicron, particularly as a percentage of cases, even at this early stage? Thank you so much.
So in fact, Jamie, I'll answer that question. For the latter part of your question, we don't have an answer to that part yet in terms of deaths associated with Omicron. Again, this data is coming in daily, and we will report that, but not just deaths, but the clinical spectrum and disease presentation. With regards to the first part of your question, yes. So, first of all, scientific collaboration happens across borders all the time, as I just mentioned. That has not stopped. That will not stop, no matter what is happening around the world. But we have seen in the situation of Omicron, the researchers in South Africa have been very willing to not only share data, not only share information, but also share samples. But the travel bans that have been imposed by South Africa have caused some challenges for those samples to actually be shipped out of the country. So there are other implications for these travel bans that are out there. We're finding a way, they're finding a way to be able to share those materials so that studies can be done. Unfortunately, or fortunately, but unfortunately, the virus passes in people. And the virus is in 23 countries now. And so that virus is available to many already. But travel bans do have a negative impact on the ability to ship samples out of a country.
Thank you very much. And with this, we come to the end of today's press briefing and the first one in this new building, new room. Thank you all for your participation. We will be sending the audio files and Dr. Tedros' remarks right after the press conference, and the full transcript will be posted on the WHO website tomorrow morning. Again, greetings from here, and now over to Dr. Tedros.
Thank you. Thank you, Christian. I think colleagues are reminding me that Sophie said her question was not answered. So I will try, I think, one bit that she's reminding us to answer. Of course, the question you asked, I have already said it even in my speech. If you remember, I said blanket travel bans will not prevent the international spread of Omicron, and they place a heavy burden on lives and livelihoods. So we're advising countries to not resort into blanket travel bans, but to do a tailored, intervention. Everybody knows that this virus has affected the world economically and also in other aspects. And the damage is being felt by many countries. But it's also sad to see that countries who are transparent and who are contributing to new information, new knowledge, are penalized. So we have said this many times, and that countries who are taking measures should consider that this is going to, their actions could punish those who are doing the right thing. And it wouldn't encourage South Africa and others to do what they're doing now if the outcome is, penalizing them. So our call has been, since Omicron was reported, that countries to take a tailored approach rather than blanket travel bans. In that way, then, they will take care of the economy and the other aspects of the world. This is not specific about South Africa and Botswana alone. I mean, we have to also consider the other neighboring countries in that region and beyond, which are being affected by such unnecessary measures. Of course, we will continue to say this, and I hope countries will listen. But again, I would like to use this opportunity to thank South Africa and Botswana, for what they have done for, detecting, sequencing, and reporting this variant soon. And they should not be discouraged by what happened, and would like to assure them that we're on their side. So thank you very much to all colleagues today from the media who have joined in our new building, the new complex. And we hope also, especially the Geneva-based, to see you in person in this building I think, this month in December. And thank you for joining us today, and see you in our upcoming pressers. Thank you.